national launch and training of key stakeholders on the use of the National Guideline for Integration of Adolescent and Youth-Friendly Services into primary healthcare facilities in Nigeria, and is holding here today. So having observed all the protocols, I will read the speech of His Excellency. I hope one day I will also be an Excellency. It is my great pleasure to welcome you to this epoch-making event of the national launch and public presentation of the National Guidelines for Integration of Adolescent and Youth-Friendly Services into primary health care facilities in Nigeria. Today marks the achievement of another major landmark event in advancing the issue of young people in Nigeria. The need to set minimum standards for the of adolescent and youth-friendly services into primary health facilities has necessitated the development and production of the guideline we are gathered to launch today. Crucial in the light of the necessity to provide adolescent youth-friendly services at the grassroots levels where a significant percentage of adolescents and other young people live. The document was developed in collaboration with the Planned Parenthood Federation of America, National Primary Healthcare Development Agency, with the funding support from Ford Foundation. And I'm sorry, I did not personally recognize our Professor Konofua, maybe because he came in, well, we have already said, but he has been our teacher both at the postgraduate level and even still very strong enough to run other NGOs who are really big support to the Federal Ministry of Health. And we want to rely for your continued support. Some other major milestones has occurred in the implementation of Action Plan for Advancing Young People's Health and Development in 2014. The Federal Ministry of Health, in collaboration with us as UNFPA, T-SHIP, FHI 360, and AHIP, among others, conducted training about Kano to build capacity of healthcare providers in the provision of adult and youth-friendly health services to improve health of our young people. Furthermore, the Federal Ministry of Health, in collaboration with Action Health Incorporated, is providing support for the Nursing and Midwifery Council of Nigeria to integrate the principles and concept of young-friendly health services into training curriculum of nurses and midwives in this country. This process has reached advanced stage and will culminate in training of students in School of Nursing City as a result. This will start up this.
Adolescents' health are not being provided in primary care level. Because if you look at the architecture in terms of healthcare provision in this country, the primary care remains the platform in which about 70% of Nigerians can easily get access to service provision. Unfortunately, a large component of the population of this country, the youth and adolescents, services that are friendly are not being provided at this level. So we felt that it's important that primary care provide integrated and comprehensive services. We've in the last 1 to 2 years demonstrated that first we've decentralized HIV services to primary care centers. We've also been able to decentralize quite a lot of other programs to primary care level. The essence of this is to ensure that any time any Nigerian could just walk into a primary care center and get complete service. Because this is a level of care that within 5 kilometer radius of where every Nigerian lives is available in most locations. Unfortunately, services are not complete in terms of integration and then comprehensiveness of service provision. So today's event, which is integration of adolescent and youth-friendly services into primary care is very historical, is very strategic. We believe that our youths should have access to preventive services, should have access to curative services, should have access to referral services, and should also have access to community-based services. Because this document is speaking to these 4 components. I'm happy that we have a lot of representation from states. Ultimately, these documents will be on and run by the states. We at the federal level will provide leadership, coordination, and the monitoring in terms of ensuring that this happens. I want to assure the Home Minister, key stakeholders, that at the primary care level, from the agency, we will continue to partner with all states and local government to ensure that this document becomes a working document. Because ultimately, what we intend to achieve is not just to launch the document and then it becomes another launching, No. We're not just doing it for the sake of doing it. We're doing it to, at the end of the day, ensure that policymakers, program managers, implementers, and other key stakeholders in the health sector will cascade this document and use it to train health workers all over the country with the essence of integrating adolescent, youth-friendly services into primary care. So we'll continue to partner with states and local governments. We'll continue to partner with other stakeholders to ensure that this happens. On this note, and on behalf of the National Primary Care Development Agency, I want to assure each and every key stakeholder in the health sector that we'll continue to push the drive towards integration of services at PHC level. And I also want to challenge Nigerian youths, challenge adolescents, that they should take up these services at the various primary care level. We also wanted to monitor to ensure that what will be launched this afternoon, this morning, will actually be implemented in your various states. I'm happy that program managers from state primary care development agencies are here. This is also a challenge to you. We'll be tracking this. We'll be developing scorecards to assess implementation of this document. On this note, I once again welcome you and commend all stakeholders that have contributed to making this document a reality.
For months of outstanding work by the Planned Parenthood Federation of the Americas, resulting in the development of a strategic plan for fast-tracking the implementation of integrated youth-friendly services within our country's primary care development system. We would like to congratulate the PPHA for this novel development, the National Primary Health Care Development Agency, and the Federal Ministry of Health for providing the enabling platforms under which the strategic developments took place. For us at the Ford Foundation, launching a strategic plan is only the beginning in efforts to tackle the nagging inadequacy and unpreparedness of our healthcare system to address the mounting health problems of our young people. Youth contribute enormously to the burden of population and ill health in this country. They account for more than 60%. Those aged less than 30 years account for more than 60% of our population. And they also account for high risks of morbidity and mortality. And youth involvement in maternal and other types of mortality account for our current inability to meet or to attain the Millennium Development Goals. I believe that going forward, the intensity and tenacity with which this strategic plan is implemented by all stakeholders will determine its potentials in fast-tracking the health and development goals of our country. Surely, primary health care, which is the foundation of our healthcare delivery system, provides a unique opportunity to counsel and to provide simple, curative, and preventive healthcare services to our young people. Because PHCs are located in places closest to where majority of Nigerians live, This integrative approach is one of the most effective ways to ensure that the most vulnerable and hard-to-reach youths have access to evidence-based health services. I would therefore like to take this opportunity to call on governments at all levels, in particular the states and local government councils, to use this strategic plan to map out policies and programs for improving young people's health, in particular their sexual and reproductive health in their various domains. The Ford Foundation is committed, both in Lagos as well as in the New York office, to catalyzing this process through capacity building and technical assistance support for scaling up the adoption and use of the strategic framework throughout the country. We believe that this is a very important and solid needed approach for building the competencies of Nigeria's healthcare system to address the health and development challenges of our young people. Once again, ladies and gentlemen, I congratulate the Planned Parenthood for...
And the NPCD, in its wisdom, have set up the PHC system, which is like 33,000 over across the country, which is a preparation. And then we have an opportunity of the youth population, which is a third of the population, needing services that are provided by these people. And so what the guideline is doing for us here is to bring the preparation that has been done by the ministry through the support from the government of Nigeria to meet the opportunity that the youth population presents. The document lays a 3-year action plan that includes measures that ensure good governance and management. And perhaps most importantly, it calls for direct youth involvement to ensure that young persons have a voice in shaping the care that they receive from these centers. I am proud to be part of this launch because these guidelines offer a smart solution. By my own definition, I think it's a very smart solution to addressing the fears, the stigmas, and other barriers preventing youths from walking into the PHC center to receive services. The guideline ensures that when the adolescents and the youth walk into the primary healthcare center, the PHC facility itself is prepared with the staff, the skills, the educational tools, and the supplies to meet their peculiar needs. We believe that the scale-up of this integration will be cost-effective and will allow improved access to sexual and reproductive health care for young Nigerians. At Planned Parenthood Federation, we strive for the healthiest generation ever and work to create an enabling environment that empowers the next generation to lead healthy and productive lives, no matter what. No matter what here means, no matter the barriers, no matter the stigma, no matter the fear, no matter the financial constraint, no matter the difficulty in geographic location and even access, we will provide services to ensure that we have the healthiest generation in the next group of people that are coming. And that is what drives our interest, to work with youth. These guidelines are an important step in achieving this goal. Thank you very much.
NFPA would be willing to partner with you in stepping it down. The one thing is to have launched the book. The next level is to step it down and train as many health workers as possible in being able to use the document. In moving forward, UNFPA is willing to partner with the Federal Ministry of Health to do that. And I think besides that, I think that the next thing we also should do as development workers is also to, besides the fact that we've done this, it's also to create the demand and remove all those roadblocks that makes it very difficult for young people to access services. We know that having services available at primary health care is very important. But it's also important to work with young people to be able to create demand.
I want to congratulate the ministry for making today a reality. Indeed, the last 3 years have witnessed tremendous progress in the country. we cannot but continue to thank the ministry for the wonderful support we have had. Let me say, ladies and gentlemen, that if this is going to go forward, it's going to rest squarely on the shoulder of National Farmer Healthcare Development Agency, and I'm sure that you have had very passionately Dr. Mohammed as he spoke, and I want to congratulate you, sir, and your agency, and we trust that you'll be able to accomplish this. I also want to congratulate the Planned Parenthood Global and the Ford Foundation with your partner, and indeed everyone who has contributed. Perhaps the greatest congratulations will go to the young people of our country.
Thank you. That's my mom that said was a diploma. She's not coming out. She's lost my mom, and told me that I'm too small for that kind of person. Hey, where did this come from? As for me, I don't know where did this come from. Let me tell you, it's from the mouth. From the mouth? Yes, this small mouth. Yes. You promised to baby. Yeah. It's very easy. Very easy. Go. Okay. Sister, it's not my thing. You know, this kind of listening to your children. They just said, my daughter says that they're welcome back from school. Thank you. No, my daughter came back from the school. Thank you. The question. They are coming from home. Come now. She's my friend who told me that this is come out from the mountain. Big girl, is this not the same question I asked you yesterday? You still went ahead and asked your friend in school where this come out from. I won't say something in this house. You are too small to wait. When you grow, you will know.
I'm saying now, what is it? Why are you eating dinner?
Because can you imagine that Dana come back from sitting after and told me that baby come out from the man. Her friend is too high.
Wait, that same question yesterday?
Yes.
You are very stupid. I told you to stop asking such questions. You are too young. Look at you. You too there like you. What did you know? I'm going to change you from that school. What did you say now? Look at you asking that women we used to call out for. Yesterday, she did. Would you tell her the truth? How can I tell her? She's too small. You better tell her, you know. If you don't tell her, they'll put her in the balance. Look at her, a little girl like this. You better tell her, kill us in this house. Tell her the truth. I will tell you. You better tell her. Let's tell your own children. I told her, don't tell her now. Tell your own children.
You see, actually, because not my mom and told me that I'm too small for all that kind of thing. You see, very, very, very well. You know, such a question. Me. I think that there is something that needs to come out of love. You see, when I can ask the money, but I just went wrong. I just went wrong. Well, I think I need something. Yes, I will like something. So what am I? Yes, that's all. This is the how much I think. How did you want to ask me a question? How did you want to know where they do come out from? What? Where they do come out from? Where they do come out from? What do you know where they do come out from? Yeah. I really want to know. Yeah. I really want to know. Yeah. Now, are you ready to know? Yeah. I want you to tell me about Australia. Are you ready to know? Yeah. You really ready to know? Yeah. I'm ready to know. Are you ready to know? Yeah. You want to know? Excuse me, ma'am. What is it, ma'am? What is it? Nothing, I'm having a problem about my body. What part of your body? My situation, ma'am. Yes, ma'am. Where is your situation? In my workshop, ma'am. Your workshop? Where is your workshop? I'm in the center area, ma'am. Your center area? Yes, ma'am. No, ma'am, we are private. Your private what? Yes, ma'am. I just saw a pastor say, yes, ma'am. Okay, we're ready to be born. I really want that. Thank you. National guidelines for implementation of adolescent and youth friendly formal care practices in Nigeria. They responsibility to account for foundation. National primary health care responsibility. Strategic government of guidelines, integrated health services, governance and management, youth involvement, supportive resources and intervention, implementation steps, implementation steps, features of implementation steps, minimum packages of services for adolescent different health services in Nigeria. I'm not taking you out of house today. This book is a very, very good book. A very good book to read. I'll go through it. Right?
It's what? private part. Private part? How much? You! From there! You see what I've been telling you? You and your parents. You see what you've caused. You made the life of you so miserable. You destroyed your future ambitions. Oh, I've made a very big mistake. Oh. I think you still know. Yeah. The other parents too will have changed. You see what you've caused?
Good afternoon, sir.
Good afternoon. Good afternoon.
What's happening here? My friend, I'm so sorry for what I did to you the other day at Phoenix. I'm so sorry. I'm very, very sorry. I hear this is the latest from the Federal Ministry of Health and Labour. National Guidelines for the Integration of Adolescent and Youth Friendly Services into primary care facilities in Nigeria. I'm so sorry. You guys are not my friend. I'm sorry. I'm sorry. I'm just a
Means protect our children. By doing so, we are protecting ourselves by the time we become children in another form. By the time you are 85, 90 years, you are already a child in another form. So you need these very children to take care of you at that time. So you protect them now, you are protecting yourselves. Let me now read the speech of the Honorable Minister. And he says, I am pleased to be in your midst today as we conduct the national launch and public presentation of the National Guidelines for Integration of Adolescent and Youth-Friendly Services into primary health care facilities in Nigeria. I commend your commitment to be part of this gathering. The Federal Ministry of Health, in her efforts to attain the health-related Millennium Development Goals, is implementing the integrated maternal, newborn, and child health strategy within the overarching framework of the National Strategic Health Development Plan. This has afforded us the opportunity to have a national framework and focus to strategically plan for the health of Nigerians, including adolescents and young people. Let me remind you that on 16 December 2010, Nigeria successfully launched its National Strategic Health Development Plan 2010 to 2015, which marked the scaling of a major hurdle in the drive to ensuring alignment and harmonization of efforts between the federal, state, local governments, and development partners. This, I strongly believe, had opened the door for all interested government agencies and development partners who might want to invest in the health sector, and particularly in the health and development of young people. Distinguished ladies and gentlemen, adolescents and other young people form a significant proportion of the Nigerian populace and play an important role in nation building when properly guided and managed. As such, the national policy and strategic framework on the health and development of adolescents and young people in Nigeria 2007 were developed to address their specific health and development needs. The federal government of Nigeria is conscious of the need to invest appropriately in the health and development of young people, and has continued to strive towards improving the health and development of this unique population subsector or subgroup. Going back memory lane, you will recall that in 2010, the federal government, in collaboration with partners, developed a national action plan for advancing the health and development of young people in Nigeria. The action plan stipulates the integration of adolescent youth-friendly service into the government system of primary health centers as one of the key actions for improving young people's access to appropriate, friendly health services. Distinguished ladies and gentlemen, this document I'm about to launch on behalf of the Honorable Minister builds on the provision of the action plan and provides guidance on how the integration of AYFHS into existing PHCs facilities in Nigeria should be carried out. In essence, this document provides program planners, implementers, and health managers at various levels with strategic considerations and broad guidance for initiating and implementing integrated AYFHS within these facilities. Also, this document draws upon a variety of documented evidence on the health of Nigerian adolescents, the state of AYFHS in the country, and global best practices in ensuring young people's access to friendly health services in public sector facilities. The document also is highly recommended for use across primary health care centers to improve the quality on our part, that is on the part of the Federal Ministry of Health. We deeply appreciate all our partners who have continued to support our various initiatives designed to improve the health and development of adolescents and other young people in Nigeria. Finally, distinguished ladies and gentlemen, my beloved young people in the house,
Excuse, some few, not everybody.
Distinguished ladies and gentlemen, I have the honor of launching the national guidelines for the integration, adolescent and youth-friendly services into primary health care facilities in Nigeria on behalf of the Honorable Minister of Health, His Excellency Professor COO AYFHS and the Federal Ministry of Health. Thank you very much. Let me re-echo the words of the Executive Director of National Primary Health Care Development Agency. That is, implementation of these guidelines is the key. Yes. The key. It is important to know the guidelines, but what is more important is to use them and implement guidelines. So I urge all Alexandria to please know the guidelines and implement them to the best of your ability. Where you are in doubt, the National Primary Health Care Development Agency is there, and the state primary health care development agencies are also there throughout the country to assist you in implementing these guidelines. I wish all of us God's guidance and success. Thank you very much. Thank you.
Picture with the kids, picture with the come around the farm. Some of you, more of you.
Come forward. Representative, state representative, please. Can you come forward and have copies?
You want to stay near more of the children, please. Young people, more of the young people.
Young person,
this is your name.
When you pick a copy.
Okay, this is just symbolic. Have you received it? We distributed later. Let me give it to the nurse and midwife. Nurse and midwife. And somebody from the States.
Thank you very much.
Thank you very much. No, a gentleman is there.
Okay.
Thank you.